Hi guys, Elective is coming up. I have no idea where I'm going. I have four options in my mind, but I'm not really too certain what to do. Barbados, Jamaica, UK, or the United States, and I don't really know where to go. Barbados would carry the added advantage of me being home and visiting all of my family and friends. But however, there are no formally trained oral and maxillofacial surgeons that I know of in Barbados. The last one died a couple of years ago. So I really don't know if I should go home and just do a stint in a hospital setting and or in a private practice, and that carries a disadvantage because when I'm trying to go abroad to do my oral maxillofacial surgical training, um, then I won't be familiar with the consultants or the attendings that would be the persons that would say, well, give me a nod to get into the program or even come and train in the hospital. So that's a disadvantage of going to Barbados. The next option I was thinking about doing is staying in Jamaica and doing my elective with the two surgeons that are two formally trained American surgeons that are here. That carries another disadvantage because once again I wouldn't be rubbing shoulders with the places that with the countries with the consultants in the countries that I want to go to. So I mean I would see a lot of things here because of a lot of trauma. One of our consultants even said that they see aminoblastoma here regularly. So I mean, the experience is or would be priceless, but it wouldn't be a good career move. I was thinking about going to the UK, maybe George's. I don't know if that is the best idea because right now money is tight, and my main goal right now will be to support the family as well as to pay off my tuition. However, from the point of view of actually going to some place that would be a good fit or on my CV, St George's Hospital in the United Kingdom would be a good place to go. Maybe even Coventry, University Hospital of Coventry would be a nice place to go. I went there to do my exam, so I was thinking about going to the United Kingdom, but it's a lot of money. You have to think about 5 weeks of living and board. I mean, I don't have to stay 5 weeks, but who wants to go there for a short period of time to then for 5 weeks and then to travel, or even for 2 weeks then to travel back to come to go to another country and have to fly back to Jamaica, or maybe I could just go to the United Kingdom and then fly back to Jamaica and do the other half here. I mean, that's always an option too. But for me, when I spend so much money to go on a plane, I like to stay for maybe a 4 or 5 week period of time to really absorb it. Because I mean, a 2 week stint isn't that long in a hospital. 5 weeks isn't long, but 5 weeks is better than two. The next option is the United States, but then I have to get a visa, which I don't really want to do. Um, that is another option. And then I have to ask myself, what's the benefit of doing my elective in the United States? Because then I still, when I'm finished, I still have to go back to do the 2 years. So am I going to do going to go there, rub shoulders with the attendants, and then still go back to school, do my 2 years, and then hope that that person's in that same position after the 2 years to give me a letter of recommendation to get into a program there? That's always an option. So I mean, there's so many things that are playing on my mind, and then I have to look for the money for the United States as well, because visas aren't cheap and they're not guaranteed as well. And even though I have no intention of staying in the country for a prolonged period of time, I don't know. I might still get turned down. So I've had that experience already. I'm not really into that experience again. So these are my four options. Tell me what you think. I really don't know what to do, and I had the transient idea of possibly going to Trinidad, which is where it all started for me in my interest in oral and maxillofacial surgery. Sorry, but at the same time, once again, it's the same disadvantages of Barbados and Jamaica, where I wouldn't be rubbing shoulders with the guys that I want to train with. So, what do I do, guys? You tell me. Thanks for watching. Subscribe to my channel, please. But I'm looking forward to hearing your opinions.